Always read the catheter manufacturer's instructions for use and follow institutional policies and procedures for midline catheter insertion. The insertion depicted in this video is a representation of the modified Seldinger technique for insertion using ultrasound. Prior to beginning the insertion procedure, review the patient chart and gather required supplies and equipment. Once at the bedside, explain the procedure to the patient, assess the veins of the arm, and select the proposed insertion site. Prior to beginning the procedure, perform hand hygiene according to institutional policy and procedure. Place the insertion tray on the procedural table and open the pouch on the outside of the procedure tray if present. The insertion tray shown contains a stop sign designed to be placed on the door to indicate that a sterile procedure is being performed. Instruct the patient with an information booklet that will be left at the bedside, describing the midline and explains the care and use of the midline catheter. Advise the patient to take it home if they will be discharged with the catheter. Cleanse hands with alcohol-based hand gel. Open procedure tray and don hair cover, mask with eye protection, and non-sterile gloves. Place a tourniquet underneath the patient's upper arm. Cleanse the proposed insertion site and the surrounding area with an approved antiseptic skin preparation solution using back and forth motion with friction and allow to air dry. Cleanse hands, don sterile gown, and then don sterile gloves. Expose the adhesive strip of the underside of the fenestration and drape the arm, ensuring that a sterile field is maintained and that the fenestration is centered over the planned insertion site. Prime the catheter or lumens with sterile, normal saline for injection. Remove the end cap from the catheter lumen. Flush each lumen with sterile, normal saline for injection to establish patency and prime lumens. Clamp or attach luer lock connectors to extension lines to contain saline within lumens. Clamping protocol will depend on type of needleless connector used in your facility. If needed, trim catheter using arrow to the appropriate length. During the insertion procedure, the ultrasound transducer is covered with a sterile ultrasound transducer cover. To apply the cover, place ultrasound gel on the probe head prior to beginning sterile setup, or place sterile gel inside the closed head of the cover as the cover is prepared. Place one hand inside the sleeve as shown and grasp the head of the transducer through the cover. Carefully slide the cover downward, covering the length of the probe and cord. Ensure the closed end of the cover is tight over the face of the transducer. Remove any air trapped between the cover and the face of the transducer by smoothing the cover with gloved fingers. Secure the cover with 1 or 2 rubber bands and place the probe carefully on the sterile field. Apply sterile ultrasound gel to the transducer. Locate the vessel to be accessed and center the vessel on the screen. Confirm that the vessel compresses easily. Administer local anesthetic per institutional policies and procedures. Visualizing the area with ultrasound. Perform venipuncture, confirming vein access by observing needle entering vein on the ultrasound screen and confirm blood return in the hub of the needle. Maintain needle position and carefully insert the guide wire through the needle and into the vessel. Carefully remove the needle over the guide wire while holding gentle pressure above the needle tip over the vessel. Thread the sheath dilator over the guide wire. Always maintain control of the guide wire with one hand. Do not let go of the guide wire to avoid inadvertent advancement or migration of the guide wire into the vessel. If necessary, enlarge cutaneous puncture site with cutting edge of scalpel, positioned away from guide wire. Engage safety and/or locking feature of scalpel where provided when not in use to reduce the risk of Sharps injury. Thread peel-away sheath dilator assembly over guide wire. Grasping near skin, advance sheath dilator assembly with slight twisting motion to a depth sus-cent to enter vessel. Thread the sheath dilator assembly through the skin and into the vessel. Check sheath placement by holding sheath in place, twisting dilator hub counterclockwise to release dilator hub from sheath hub. Withdraw guide wire and dilator sufficiently to allow blood flow. Be sure to quickly place finger or thumb over sheath end upon removal of dilator and guide wire to reduce risk of air entry. Always verify entire guide wire is intact upon removal. Retract contamination guard. Insert catheter through peel-away sheath to find indwelling position. Retract and/or gently push while advancing catheter if resistance is met. If catheter migrated during sheath removal, re-advance catheter to final indwelling position. To complete the procedure, attach a syringe filled with sterile, normal saline for injection to the catheter hub. Aspirate to assess for free-flowing blood return, and then flush the catheter using a pulsatile technique to clear the catheter lumen. When applicable, a second site hub catheter clamp and fastener can be used as a securement site if necessary. Both catheter clamp and fastener need to be secured to reduce risk of catheter migration. Catheter stabilization device should be used in accordance with manufacturer's instructions for use. Ensure the insertion site is clean and dry before applying dressing per manufacturer's instructions for use and institution policy and procedure. For more information, contact your Teleflex vascular representative or visit us at teleflex.com.